Welcome to the CHOW Podcast, hosted by Animal Friends of Wyoming County, where our mission is to help care for animals held by the Wyoming County Animal Shelter and promote responsible pet care in Wyoming County. Thank you for joining us. Welcome, everybody, to the Animal Friends of Wyoming County CHOW Podcast. I am your host today, Sam Goodell, the president of Animal Friends of Wyoming County. And today we're going to begin into a conversation for new dog owners, or even if you're an existing dog owner, but it's been a while since you've had a dog, you want to get back into having a companion animal at home. We're going to be discussing some like a guide to getting a new dog or associating a dog at your home environment and establishing a veterinarian and all the things you need to look out for. Joining me today for my co-hosts, I'm going to introduce, are both animal control officers. They've both been on this podcast before. So I'm going to start off with Officer Darrell. How's it going today, sir?
Oh, I'm doing excellent. We're here.
Good. We're here. We're working. We're going. All right. And Officer Goodell, how's it going?
It's going great. Going great.
Going great. Awesome. Anything new and exciting at the shelter at this time?
Well, grant repairs or grant changes. We won the grant, another grant. So we have about rounded off, $320,000 will be put into the building. So we have an airflow system coming in and generator coming in soon and new flooring in the office. So looking at a water purification system coming. So said that right. So we should start seeing some activity up here. They were waiting for some equipment that had been back ordered, parts to some of the airflow.
Back ordered equipment and to finish up some previous projects that are still being worked on.
So we're kind of getting ready for that.
Okay.
That stuff. So
that's exciting.
Adoption's been going good. Adopted 14 dogs out in one day, so adoptions have been going well. Been a busy joint. We're kind of taking an moment, doing some cleaning and extra stuff. So
yeah, we're filming this right now. It just hit October. It's October 5th already, and so it's getting to a little bit of a. Would you say this is a low at the animal shelter?
Well, it's quieter time, which is good. It gives us a little chance to do some extra cleaning things. Going down into pipes and scrubbing tops of pens that you don't get to every day, and extra floor cleaning and wall cleaning and
focus on the finer details of cleaning the shelter.
Yeah,
there you go.
So we're kind of going at it. So.
Well, there has never been one complaint of anyone walking into this animal shelter thinking it's dirty. So you guys do excellent.
Actually, when they came into our study, they told us we clean too much.
Yes. Yep. So they told us we overclean.
You overclean, really?
I know. That's what I said.
Yeah. They said we should spot clean more. Like, all right, it's less stressful on the dog. So,
well, as our podcast continues on per episode, there are some new things that are developing in New York State in regards to laws, especially for animal control officers that they'll have to go through. And so you'll be learning things as we're learning things here and go from there on those things. We might even talk about some of them as we're discussing our main topic for today. So speaking of which, this is a good time to segue into our guest of honor here at the podcast. I have the privilege of saying I get to work under him at some points here or there. I don't work directly in hand with him at the location that I work in for my primary job, but I still see him every now and then, and this is a pleasure to have him join us, Dr. Ted Wolf. How's it going today?
It's going good. It's going good, Sam. Thanks for having me.
Oh, of course. Well, thank you for doing this. This is a great topic that we're going to be discussing today. A guide to getting a dog, basically. What things to look out for. And tell us before we dive in to our podcast, though, a little bit about your personal life or anything. Give us your backstories.
Sure. I grew up in Ohio and decided kind of late in the high school career that I decided I wanted to be a veterinarian. I originally wanted to be a dairy farmer. Went to the Ohio State University and did my undergrad and my vet school there, and also met my wife there. And she and I moved up here. She graduated a couple years ahead of me, and after I graduated, we came up here to Western New York, and we've been here since '97. Raised our 3 children here. Our 3 children are all grown and actually living out of state. So we I particularly like to do some traveling to see the kids, number one, but just traveling in general and spending time with my wife. We like to be outdoors. We like to walk our dogs. And I originally got into veterinary medicine. I wanted to be just a cow vet. And as time has gone on, I've done more and more companion animal. And, I really have always had a love for dogs. And I think more and more, that's even gotten stronger. I enjoy dogs so much, working on them. Our own dogs are such a big part of our family. So it's kind of fun for me to talk about this.
Great. Good. Cool. Yeah. You and the other Dr. Wolf, you're kind of like the dynamic duo of a vet clinic. So
I don't know about that.
But it's a pleasure to work with both of you guys. And
thank you.
What are your passions outside of veterinary work? Do you have anything that you like to do in your spare time, if you get any?
Yeah, I do. I really like the outdoors, fishing and hunting and traveling. We have started to do some active travel where we do bike and hike trips, seeing all over the country, and that's been a lot of fun for us. I don't care too much for the touristy stuff, but the off the beaten path a little bit, and of course we do a lot of time out. All three of our children right now are in Colorado, and so we get out there as much as we can. But we have a little farm, and I like to do some farming also. We raise some heifers still, but just busy. Like to be busy, and certainly enjoy the people we work with and the pets we work with, and so forth.
Would you say you are as athletic as Dr. Liz is when it comes to outside vet clinic?
No. I tell everybody she's. I spent the last. I don't even. We were married in '95, so the last 28 years, about 5 steps behind her. Yeah. She's the good vet in the family, and she's certainly the athlete. Yeah.
Oh.
Yeah, awesome. Well, cool. Well, thank you for coming in today and doing the educational video that's a part of this podcast and joining us as we're trying to educate our community and the world at large on any of these topics related to our companion animals. This is a good topic to discuss today when you're looking to adopt or purchase a pet. I know that's one of the biggest things that the animal shelter gets a question of is not only are they interested in getting a new dog, and even adopting in the adoption process, which both Officer Goodell and Officer Klump can be able to walk someone through. But if someone's looking for a puppy, looking to buy a puppy, looking for a reputable breeder, how do they know they're a good breeder or not? Some of these things. What do you have as your perspective as a veterinarian when it comes to someone getting a new dog in general?
Mm-hmm. Yeah, I think the first thing is just thinking about it for a little bit, discuss it with the family and what are we looking for? I mean, this is going to be part of your family and this animal will be with you for years and years to come. And what are your expectations? What do you want out of this dog, puppy? How active are you? How big of an animal can you deal with? And look into it. Look into the breeds and their behaviors. Their tendencies for different diseases, and then start your process. Do you want to adopt? There's certainly a lot of animals that need that, versus going and getting a purebred. And can you give an animal a good home and lots of activity and lots of stimulation and just provide an environment where you get as much from them as they get from you.
Mm-hmm. Yes.
We find that just to segue with him, oftentimes the dogs that get surrendered here or become problem dogs in someone's home are those quick, I'll meet you at Walmart parking lot at 10 o'clock and take this dog off your hands, free to a good owner. Then they get him home and they kill the cat or bite a kid, or we get the weekly calls that spur the moment adoption, or taking on a dog just because. And then you get to thinking about it, or it doesn't work out in their home. And guess what? The animal shelters, most common animal shelters are pounds that they used to call them, or SPCAs, get burdened then with dogs that they didn't have any clue what they were getting. You know, we've had people call and say they sent me a picture, but when I picked the dog up, it didn't even look like that. So, I mean, there's some scamming going on too at the same time. So we tell people when they come here and they put an application in that they need to really, we want to walk. If it's, oh, I want that dog and I want to take it today. That's not happening. I want to discuss it with them. I want to know their lifestyle. On the application, we see if there's other pets involved. Have they been vetted? You know, we're gonna let a female little puppy who can't be neutered right now out to a house that's got 3 unneutered males. So you're constantly in the process. You're educating people on, what you should be doing.
All right, so ladies and gentlemen, we had to take a quick pause here. We're live recording this at the Wyoming County Animal Shelter, where we do all of our podcast episodes. And we had someone come in for an adoption. So animal control had to get up and take care of that, which is a good thing. Adopt a dog. But
Our work is never done.
no, never done. So in the meantime, we also have someone else joining back onto the podcast. So welcome, Tom, our program director. How's it going, sir?
Good. Nothing like starting a day about an hour late, but I'm here.
That's fine. You're here. We're ready. We're rolling. So, before we took that pause, Officer Goodell, you're talking about how people get a dog on like a knee-jerk reaction.
Yeah. And I think that's one of the most frustrating parts of our job is it's one thing if you have a family pet and it's just not getting along with another dog, or you're struggling to train it and you kind of want to just give up, and they have good history. But when we get a dog that's like I used before in the example, I got this dog from the Walmart parking lot in the back of a truck. I'll say, do you have shot records? Well, they said they had them. And, we have to literally start from ground zero then and and that's frustrating. And I do feel bad. There have been times we have not taken a dog because it is already exhibiting unadoptable tendencies for our shelter. Doesn't mean it's not redeemable. It doesn't mean it can't be fixed, but in our setting, and in our liability here, we can't. It's not our place to do it. So if a dog has bitten a human being or killed an animal here, we can't move it forward into a new home. So we try not to take them because we don't want to also be an agent of euthanizing if we don't have to. Doesn't mean we don't if we have to, but we really don't want to do it. And so by taking a dog with those tendencies already exhibited and a history, we're kind of stuck because liability for the county is if I move that dog into another home, goes down the street and bites a young girl or kills another dog, and we know that it had those tendencies prior, we're just part of that chain that can be sued or the liability of moving that dog onwards. So they're frustrating because I want to fix all dogs. I want all dogs to get a good home. But I realize I'm limited in what I can do here. So, and this environment isn't always so good for some dogs who've already got some bad tendencies. Being penned up makes their anxiety a little higher. Their fear, if they're a fear biter, they're even more afraid here. It takes a long time to get past all that. I don't like to give up on a dog, but there are times to take one in, deliberately take one in that's got a bad history is a tough place to be.
So
Yeah, just to have the hollow balance that I've watched her have to juggle for about 13 years now. Because, if you walk in and meet one of our dogs back here, that animal might just go off on you. And it's like, geez, I don't want to touch this animal, and, we'll take it out of the cage. You don't do that. Well, the dog's got so many strikes against it already. And once Justa has gone through this, realize that it's a fight or flight fear problem, then we know all we have to do, and carefully, is get the dog out of the kennel. And once we get the dog out of the kennel, we've seen some of the really bad cases that went home. One went home and been living with your son for 10 years.
That's right. Yeah.
Shirley's a great animal. She's a great dog.
I tell volunteers the most unpredictable spot in the shelter is at the door of the kennel. The coming out and the going in, it can be so stressful for the dog. Or if a fear is the problem, that's when the nimbing will happen. So often, until the dog is used to us and we really know the dog, we entrust it to have anybody take it out. We are the put-her inners and the take-her-outers. That's how I put it to the volunteers. We're the ones that handle that dog in and out until we know that that dog is okay. Because we don't want to have...
Animal worker, these officers here, they're trying to figure out, is this dog a good idea? And it's already here. And what are we going to do to make this dog calm down so that it can have a happy life?
That was definitely
a great job.
one of the hardest decision processes I had to learn being a new officer coming into this job was how to determine, is this dog going to be okay? Is it not going to be okay? Where do I need to back up? Where do I need to push a little harder? That took a little bit.
And it takes every once in a while, it just takes that leap of faith. Okay, we're going to do this.
Yes,
We're
absolutely.
gonna work on you right now. We're going to get you out of this cage, and you're going to be a good dog.
There's been a couple of dog instances where I've gotten to the point where I was like, okay, it's down to the wire. Either you're going to bite me or we're going to do this. And I put my hand in there, and so far, knock on wood, I've been pretty lucky. But sometimes it's been a little scary.
Well, it's not just here at the animal shelter too. I'm sure they experience that in the vet world at the vet clinics, because you don't know when a client's coming in with what type of dog is it, especially if it's a new dog to their home, to their environment, and coming into a vet clinic for the first time. How temperamental is it going to be? Is it great with women but not great with men? Things like that. How is it going to be in an environment where we're poking and prodding him? What's your perspective on anything like that, Dr. Wolf?
Yeah, you look and you'll see you've got a dog coming in and it's got warning, hey, does better with men, does better with women, mostly women usually, or is it already on a sedative that we've determined that going forward this dog just does better to have a little bit of a tranquilizer so that their stress level is lower and they're less reactionary, and that the visit can be less stressful for them, so that then when they go to the clinic, it isn't such a anxious time, or the anxiety is much less. So we see a lot of animals now that we feel do much better with some of those tranquilizers, and it's made working on them safer, but more importantly, less stressful for the animal. And where then maybe it's at a point in time that, isn't stressful and they don't need that, to going forward, that sedation, I should say.
We just had that last week, Doc, where the most melon-headed and mellow dog you're ever going to want to meet is Grammer. It's a pup I got from Justin and Sam. And he's just been a thunderhead his whole life. He's just easygoing. It's just a big love dog. Brought him in to see Dr. Kendra last week, and he just went off. Like I stood there in amazement that I can't believe this is Grandma. We kind of figured out that he was trying to protect his little brother, I think.
Yeah.
Who's had a hell of a life so far. But that was an education for me to see this dog go off. And Dr. Kendall, she was amazing. She just went and gave him a big hug and calmed him right down. He's licking her face. But, oh, man, that was got to be frightening for you guys dealing with this all the time.
Yeah, from the dog's perspective, many dogs travel quite a bit, but some don't. They get into the car to go one place, and that's the vet. Then they get drug out of the car and put into a small room, and then the stranger comes in. It's nerve-wracking for them. So we have to do our part to try and reduce the anxiety, but be less aggressive and when approaching the animal, and understand why their tendencies are what they are, and approach them that way so that we protect ourselves, protect the owner, and then protect the dogs.
Yeah, it's amazing what you guys do and how you do it. It's pretty impressive.
So we've already talked a little bit about adopting a dog from the shelter and the process of going through that. We've talked about that on the podcast before. But one of the other things that we get questions of from our members and from the public in general is when they're out looking for a dog. And yes, we always recommend to adopt rather than shop. That's the same how it goes. And we do encourage people to go to an animal control or animal rescue, an SPCA, Humane Society, whatever it may be in your area, to see if there's any cats or dogs that you can adopt as opposed to purchase. But sometimes you get those families that they just want that golden retriever. They just want that Cocker Spaniel. Or they want that certain breed because they've grown up with it their whole life and they're just going to continue onward. One of the hard things for people to look for in this day and age, especially with the heightened sense that we all have now of puppy mills and how they're operated, and given that in our state in particular, New York State's trying to crack down on puppy mills with laws that are supposed to stop that. How do Dr. Wolf, how do you navigate someone who asks you, how do I look for a reputable breeder? How do I look for someone that I think I could trust that raises these type of dogs that I don't feel like I'm contributing to a puppy mill or a backwoods breeder?
Yeah, that's a question. Great question. We get it a lot, and I say, first thing, you do your research. Find and if they're reputable, they should have references, people that they've sold dogs to, and the other thing is, what questions are they asking me as a person that wants to come in and adopt? If they're like, yeah, meet me at Walmart at 10 p.m. We'll make the transaction there, then that's a big red flag. Versus, no, what's the environment this puppy's going into? How many animals have you had in the past? Do you have fencing for this animal? What is your work schedule? Do you have children that will be involved? So I want to know what they're asking me as a potential owner. And then I would like to see, and in some cases you can't go and see the kennel, but if you go to the breeder and they put you in a small room, but you can't see the parents, and they're, how clean is it? Are there 100 cages in the backyard? Things like that are red flags as well. They should be able to open up their kennel so that you can see and especially check their references and find out, what are they requiring of me? Are they concerned that I am appropriate for this puppy as well?
That's very good. That's a very good point and observation. Transparency is a very big deal. It goes both ways. So you're looking for a new dog. You're looking to get a puppy for your family, and you're going to be asking a whole bunch of questions on the puppy's upbringing, the parents, things like that. And expect the breeder or the raiser, however they want to describe themselves, to ask you questions too, because that shows a respect on both sides and an understanding that we're not just going to give a puppy to just anyone. We want to make sure this puppy is going to have an adequate life, going to get the vet care it needs or get the love it deserves and things like that. So that's a very good point of a red flag. That if they're not asking you questions and you're just asking questions, that's a little sketchy.
Right. Agreed.
Yes.
Agreed.
Yeah. And so that's one of the big signs to look out for. And coming from a veterinarian perspective too, when it comes to like vaccines the breeders perform and services such as that, you could go to Tractor Supply now and purchase dewormers, purchase vaccines and things like that. But how do you know you're administering them correctly? Or in the vet's eyes, what do you feel about someone who does vaccines, whether they're breeder or they're not a breeder, on their own?
It makes me nervous, to be honest. We're trained to give the appropriate administration. We give certain vaccines in certain sites. So if there's a reaction, we know which one it's reacting to. There are specific dewormers that we use based on fecal samples that we receive. And, breeders, and there are some excellent breeders and many well-educated breeders. But oftentimes, they want to do things as economical as possible, understandably. But we want to do things on the veterinary side appropriately for the health and well-being of the animal. In many cases, breeders are they're in it to make profit. And that, again, I'm not faulting them for that, but we need to know, was that vaccine stored, refrigerated properly? Was it given in the right spot? Was it given it appropriately? What was the deworming schedule? We see some of these breeders that start vaccinating very, very young while there's still maternal antibody interference. So those first vaccines are probably wasted. And then they're giving, in many cases, they're giving a lot of wormers very early on. It's maybe overkill, and we could create an environment where we're creating resistance and some parasites. So we want to deworm appropriately, but we want to deworm so that we're going to specific parasites and so forth. So we base those on our fecal exams on the veterinary side. It does make me nervous, and not that they can't do a good job, but if we get a scrap piece of paper that said with a couple stickers on it that said we gave it this day and this day, many times we just start over. We say, let's wait 4 weeks. Let's start over and do it properly.
Yeah. Yeah, that's a good point too, because we don't know how the vaccine was handled in any way, whether it's even from the breeder or the dog owner or from the company they bought it from or the retail that they bought it from. We don't know how they were stored. And so I always have recommended, if you're going to have your dog vaccinated, have a professional do it, whether it's a veterinarian, a veterinary technician, someone who has the skills, the knowledge, and is trained to handle those situations in case something goes wrong, because they do. We get vaccine reactions. Dogs get vaccine reactions. Cats can, and if you have to administer it properly. So I kind of, in my mind at least, as just an outsider observing everything, I always see someone purchasing vaccines on their own as kind of like a red flag of, are you educated enough to do it? There's no law or anything that says you have to be a certain requirement to be a breeder, unfortunately. So literally anyone down the road can be a breeder. Doesn't mean everybody should be. So if someone is interested in, I got a dog at home, he's a purebred Cocker Spaniel, and I know a purebred intact male, maybe we could have a litter sometime. Know what you're getting into. Definitely consult your dog's veterinarian first before you do anything like that, because you're talking about bringing in dogs into this world that, one, you want to make sure that they are wanted and it's something they're going to be cared for, and two, you're doing what's best by your dog and providing a service like that.
For sure.
So sometimes it's hard to navigate who's a reputable breeder versus a not reputable breeder. But just if your gut tells you, and you're going to purchase a puppy and your gut tells you there's something wrong here, there's something fishy here, most of the time there probably is.
A good example, of bad breeding was a religious group just brought in 3 dogs recently and said we had 9, 6 survived. We're going to just drown these 3. But just accepted them. And then there was this right-wing conspiracy to stick me with and he's a fantastic animal, but he came to me with a blind spot in his left eye, Lyme disease, and double hip dysplasia.
Oh, yeah.
And, no wonder they're going to drown the poor thing. But in spite of his problems, he's the happiest dog I ever met in my life, and he's probably the fastest.
Yeah.
But this is bad breeding. This is bad. We just threw the dogs together and we'll drown the ones that don't work out so well. Okay.
Right.
I mean, this is a terrible mentality. And how much of it is out there is why we're doing a podcast like this. We want the listeners to understand there's a lot of this. There's too much of this, I should say, out there. And how do you fight it?
It's difficult, and we were talking earlier. To many of these non-reputable breeders, these animals are nothing more than a commodity,
right?
And if they don't fit into their window, they talk about we're just going to drown them. And that's unacceptable. We don't need that. We don't need the extra animals, and they're going to go to some unprepared home and find out they have double hip dysplasia. And now we've got to intervene medically, and many people can't afford to repair that. So then the dog's living with discomfort. So, yeah. I think doing research, taking a step back, take your time, look into it, check references, find out what they're asking me as a future pet owner, and if they all check out, go for it.
Yeah, references is a very good point, because I would feel that if I was going to adopt a dog or purchase a dog from someone, I'd like to know, where do you take your pets to? Do they go to a veterinarian? Are they being seen? And stuff like that. And most of the time they'll say, oh yeah, you can call my vet and you can just get, I'll let you access to my account or whatever it may be. So that shows transparency from someone who's getting a dog, that, yeah, they're not only saying they have a litter and they've taken their dog to Perry Vet or to whoever your veterinarian is, but that it's okay to ask those questions. You don't have to feel like I'm prying into someone's, because you're getting a dog and you want to know it's been vet checked. It's got a health certificate. It's all good.
And one of the problems I've noticed a lot, though, is So subsequently, you wind up with, okay, this is a good breeder. They're trying to do a good job. They're doing their thing. But I see this happen with golden retrievers. You know, the golden retrievers, the big cuddly one, is now getting aggressive, you know, because of overbreeding. This is what's going on. It's just a simple overbreeding. And you can't stop that because it's not illegal. But be aware of it, listener. You know, your dog's bloodline just might have been a nightmare. And now you're going to get a dog that you think is wonderful and actually should be. It's aggressive toward an owner or children. And, you know, golden retrievers were never known to be that way, but now there's a lot of problems with it.
Yeah, it's a great point.
One of the things that people who are looking for a dog from a breeder that they may want to put in the back of their mind, if the breeder tells them that they are selling over 25 dogs or puppies a year, they have to have in New York State a pet dealer license. So they are inspected by Ag and Markets. They will need documentation of who their veterinarian is. Are these puppies vaccinated? All that paperwork has to be in line. How clean is it? What kind of breeding are you getting done? Are you breeding brother and sister? They look at that stuff with a pet dealer license. So if you're communicating and you just kind of say, gee, how many puppies a year do you get out of your 3 females and your male? And they say, well, last year maybe 30 some. That should be a red flag. If they are not have a pet dealer license, you should then not purchase because they're not being looked at. It's a business and it is mandated by the state of New York. If you sell over 25 dogs, you have to, it doesn't matter. It could be even mixed Shepherd Husky. If you're selling, period, it doesn't have to be AKC or a purebred. You have to have a pet dealer license, which brings an inspector in. They look at what your waste disposal is, how they are interacting with each other. Is there an enrichment program for the puppies? So you can go on some websites and local breeders, and you'll see where the breeders' puppies are playing with toys that are dangling, and they are introducing them to things before you ever get the puppy. So it's those things they look for enrichment, and what their animal husbandry program is. Those are things we get looked at here. So it definitely needs to be 25 over. They need to have a pet dealer license. So.
And yeah,
that's a good point that you brought up, Justa, about early socialization, enrichment, getting them used to an environment that may be loud at times with children or busy with toys and things that they are comfortable with, getting them used to you intervening with their diet or their food at your will, things like that at an early age, that socialization, that training. If breeders are doing that is, and good breeders do,
yes,
that really puts your puppy on a really great start.
Yeah.
And you can adopt that puppy and just keep going with that, with your training and your socialization and so forth.
The litter of puppies that were born here at the shelter just recently, once they got to be a certain age, we encouraged our volunteers to handle them, separate them out and play with them. We felt bad. We didn't dare put them on the ground out back at the puppy playground because they had not been vaccinated yet. And even though we've had no diseases here at the shelter, we don't know what's lying underneath. So we didn't put them outside on the grass. So they were probably the first litter that didn't actually touch grass before they left here. But they had no shot record, no shots. And Mama came in with no shots and was bred. So I didn't know what she was passing on to them. So we had a lot of little things we had to tweak. But we did a lot of toys in the area where they were, getting them used to other people, and we brought them in with the TV playing, so they weren't didn't know anything about anything. So
yes. Yeah. So yeah. I forgot where my train of thought was going to go on that, but it's just be mindful of when a dog that young, they're puppies, some of them not old enough at that point to have vaccines. There's an appropriate time to get them vaccinated, and don't socialize them with other dogs, even if they are vaccinated, because you don't want to pass around any disease to this young immune system that's not yet boosted enough for it. Right? Yeah, they get prone to it. So segueing that onto vaccines in particular, what vaccines, Dr. Wolf, would you feel are the core vaccines when it comes to vaccinating your dog?
Well, our core vaccines are distemper, lepto, Lyme, and rabies, of course. Now, sometimes it's not one size fits all. But if your dog is going to be outdoors, socialized, those would be definite. Distemper, lepto, Lyme, and rabies would be a must. And if they're going to be socialized with other dogs, I would add kennel cough to that as well.
Mm-hmm. Yeah. So that's, what was that, about 4 vaccines you'd say at minimum is for the distemper, lepto, Lyme?
Yeah, okay. and that is, even myself, it seems like, geez, that's a lot of vaccines. Mm-hmm. And what we have done is once they've had their first year, what we really want to do is establish that immunity early. And once they have a good immunity, then we can back most of those to every 3 years. The distemper and rabies will then move to every 3 years. So we're not vaccinating as frequently. Lepto and Lyme are annual vaccines. And the reason for that is the immunity doesn't last a long time with lepto and Lyme vaccines. Otherwise, we would move them to 3 years. Now, down the road, maybe with different vaccine technology, we may be able to move those to every 3 years, because our goal is not to over-vaccinate. Our goal is to vaccinate appropriately for disease prevention. Mm-hmm. And these vaccines work. With the distemper, if we still see a lot of parvovirus, dogs are not vaccinated or inappropriately vaccinated, and they're at risk. Kennel cough, I've been practicing for about 27 years, and kennel cough is as bad now or worse than it's ever been because dogs are much more social now. There's doggy daycare. They're going to the dog parks. And I think that's great. That's great for the dogs. But be aware, just like sending your kids to preschool, they are much higher risk for these respiratory diseases like kennel cough and that complex of viruses and things that cause that. So, we're vaccinating for diseases that we see, not that we don't see. Lyme.
That's a good point. I was going to bring that up.
For years, we would test for Lyme disease and have, maybe 6 to 10 cases of positive a year. Now we're well over 150 to 160 positive per clinic. It's just gone on a huge rise because of the tick population and so forth. So, you need to protect them against Lyme disease, as the same as we need to protect ourselves against that tick exposure.
Yes, a good point. Now, leptospirosis. What is leptospirosis?
Lepto is a bacteria, and it's transmitted in the urine of wildlife, deer, raccoons, rodents, things like that. And if an animal ingests lepto, if you're swimming in a pond or they're on a walk and they lick a puddle or off of a dew in the grass, and lepto gets into the body, it can get into the kidneys. And if it gets into the kidneys, it causes a kidney infection and kidney failure. Lepto is ugly in dogs that are positive and that are sick with it, because it can be fatal. It causes a lot of damage to the kidneys, long-term kidney disease, and so forth. So, we once thought of lepto mainly as a farm dog issue, but we see dogs that are in a village that, like to go on their daily walk, at times that can be susceptible to lepto. So, we continue to vaccinate for lepto annually.
Do you see leptospirosis around our area as a big cause of concern, or?
Yeah, I would say we see as much lepto as we probably do parvo. And I don't have the statistics in front of me, Sam.
Yeah.
But the problem with lepto is it also we can contract lepto as well. So there is that issue as well. If we have a potential lepto case in the hospital, they have to be in isolation. We have to use isolation protective gear to handle that animal. So because we're at risk as well, and certainly with families and things like that, we want to prevent that. Many of the, like rabies, for example, is another reason we vaccinate, because it is a human risk, or what we call a zoonotic disease. And lepto is a zoonotic disease as well.
Yes, I didn't know that.
So that's why
That's really good info.
lepto part of those core vaccines to get. And the cool thing about taking your pet to a veterinarian, no matter what type of breed it is, the size of the dog or anything, your vet knows what the regimen and the schedule will be to get these core vaccines done. So you're not over vaccinating at one time. If you have to split them up every 2 to 4 weeks, or however long it takes from your Shih Tzu all the way down to up to your Great Dane puppy, they'll know what's appropriate to give them. So that's one big reason why I encourage anyone who's going to vaccinate your pet, take them to your veterinarian.
Yeah, I run across that a lot, where people will say, hey, can you give me some advice about your puppy or my puppy? What should I do? And I say, I'll tell you this. Handle their paws a lot, because you're going to have to clip their nails someday. Put them on their back to see if they can tolerate it. And more importantly, go to a vet. Go to the veterinarian and make sure that your dog is okay. Have your veterinarian take care of your dog. Because I'm not giving you the advice you're going to look for here. Your veterinarian can.
Yeah, I think that's good advice, and I again, I think this early intervention and like you say, playing with their feet, just subtleties, getting them used to a lot of different environments. Throw them in the car, take them around the block, and let them out. Every car ride doesn't have to be a trip to the park or a trip to the vet's office.
Right.
Get them used to being in and out. Get them used to a lot of different environments, so that it isn't an anxious thing for them. They enjoy. They enjoy their car rides. They enjoy going to the park. They enjoy going to daycare. They enjoy going to the vet's office. They enjoy going to the family picnic.
So we've touched upon, Lyme and lepto so far, but parvovirus. Can you explain to us a little bit the backstory of parvovirus? How important is it for us to vaccinate against it? And tell us about the disease.
Parvovirus is an enteric virus, so it attacks the intestinal lining, and it is also can be a fatal disease. It tears down the intestinal wall, has the villi on them, and that are responsible somewhat for absorption of our diet and digestion and absorption. And the virus attacks the intestinal wall, opening up that intestinal wall. Then the bacteria from the intestine can get into the blood. So they usually show up, they're vomiting, they're dehydrated, and then they have this fetid diarrhea, oftentimes very bloody diarrhea, can't hold anything down. And, we can rehydrate them, but if the intestinal lining is broken down, there's very little protection for that bacteria to get into the bloodstream. And so that's why it can be so, it can be fatal. So by vaccinating them, they develop that immunity to the virus and the bacterians that we're giving, and it's protective. Again, though, you have to, if you start to vaccinate too early, this isn't an immunology discussion, but if we're vaccinating too early, the maternal antibodies that they get from mom when they nurse, that first nursing where they get their colostrum, that actually blocks our vaccine, so it doesn't work. And then our boosters and so forth aren't effective because the timing is not right. So generally we recommend starting the vaccines about 8 weeks. And circling back to parvovirus is in the distemper vaccine. And probably the most prevalent parvovirus and parainfluenza, which is part of the kennel cough complex, are two of the most common things that we see. Distemper, the distemper vaccine, it's not, I don't very often see a distemper. I have one distemper dog. Most dogs that get distemper die, or it becomes a very chronically ill dog. I have one I'm dealing with right now, and this poor dog is just constantly ill, and it's got great owners. It was adopted, probably from Walmart. I can't remember the specific circumstance, but they got 2 dogs at once. They are good owners. They felt bad for these dogs because I think they were outside of Ames or something like that, Ames Plaza, and sure enough, one of these dogs, it looks like, has distemper virus. So, not a reputable breeder, and not vaccinated appropriately, and that's that's the risk you end up with.
A lot of people who are, this is a normal question for people who are adopting their pet, and I'm sure you hear the question a lot is, what do you recommend on feeding? What's good? What should I stay away from them?
Yeah, that's a good question, and there are a lot of probably right answers for this. I still stick to the commercial brands. When I was prior to going to vet school, I actually did some research for Purina. And not that Purina is the only reputable brand, but I got to see the quality control they have on their ingredients. Keep in mind with pet food, 95% of it is marketing. The bag, the color, the names are all great. But you really want to make sure you're using a food that has a lot of veterinary research behind it, that was developed by veterinarians and veterinary nutritionists. I don't really want to get into specific brands. That's something I would suggest you discuss with your veterinarian or your nutritionist. But we hear a lot of people like, well, I want to feed a raw diet, and I will warn against raw diets. Your animal is much higher risk for these enteric diseases, salmonella, listeria, things like that, just like we would be with uncooked food. So I think it's a really good discussion to have with your veterinarian. But make sure you're getting good ingredients, good protein, and then find out what their calorie needs are and feed appropriate to that. I saw one of your previous video blogs about Dr. Capel did about obesity, and we do see a lot of it in our pets, and it's a 100% preventable problem. So, good quality diet on a good feeding schedule. Not many dogs can handle just having food 24/7. They should be on a feeding schedule. I usually recommend puppies get fed 3 times a day until after they're spayed or neutered, and then you back them off to twice a day. But again, that's a discussion.
That's a good segue into our topic at hand. When you're getting a dog for the first time, or you're getting a puppy, especially when it comes to like pet obesity, and communicate with your veterinarian to start at a young age to get them into good eating habits. So if your dog is going to be prone to getting obese, perhaps before or even after the spay and neuter, which is the tendency that happens, that you could start it early, because prevention is key to getting it out of control and getting it back on track. A couple questions I have to finish up on the parvo virus. Some of these vaccines, when you're getting them for the first time, like leptospirosis or Lyme, if your puppy is getting it for the first time, they need like a booster about a month out or so. Right. Why does parvovirus need 2 boosters when you start getting the distemper DHPP vaccines?
Well, that really, Sam, depends on when you start giving it also. If you were, say, to have a 6-month-old puppy come in, you could do just 1 booster. But if you're starting at 8 weeks, we would do 2 boosters of that along with the distemper. That's just how our protocol is. The reason being, you start them at 8 weeks to protect them young, and then you want their last booster to be given after they're 12 weeks old. So in order to get that timing appropriately, they get that 3rd booster.
Okay, that makes sense. It keeps the immune system primed for it.
Right. Yeah. If you're starting too early, then you might not get that first immune response, appropriate immune response, and then you want to get that last one after they're 12 weeks, because at that point the immune system is mature and they have proper humoral and immunity to respond to that.
Mm-hmm. So besides our core vaccines that we discussed about, actually, before I get into that, there's one other vaccine we haven't discussed yet that's a core vaccine, the rabies vaccine. Yeah. Can you tell us a little bit about what is the rabies vaccine, what makes it important, and why do you feel in New York State that is the only one required by law?
Mm-hmm. Well, mainly because of the potential issue to us. It's a zoonotic. And we do see rabies cases. Okay, we get rabid animals that are in, and if there's a human exposure, anyone. I'll give you a story. One of the dairy herds that I work with, we had two calves that started to just vocalize. They were mooing. These were about 4 months old, and they started to vocalize. Well, initially it was odd because it was one at a time, and I wasn't sure. But as the animal progressed, then it started to have the hypersalivation. Well, we were able to send samples and determine that was rabies. Well, anybody that had contact with those animals, which included me and about a dozen people on that farm, had to go in for our rabies shots, and so nobody contracted rabies, but anybody that gets rabies dies. That humans don't live if they get rabies, and that's why it's so important. And it's prevalent in the wildlife: raccoons, bats, skunks. Most commonly, we see it in kitties that are exposed. These calves that I'm talking about, they were exposed from a skunk. And oftentimes we don't even know where it comes from, but it does cycle through our wildlife, and it is in the area. So it's in the law that we have to do it. And for those reasons, we certainly do it.
Yeah. So what does rabies do if animal contracts rabies?
Mm-hmm. So rabies gets into the nervous tissue, and once it's in the nervous tissue, then it's fatal. But the virus travels through a peripheral wound. It's usually transmitted through the saliva into the blood, but through a bite. Can be if you have an open wound and you get saliva on you, transmitted that way. But most commonly, it's a bite, and it travels through the blood into the nervous tissue. Then it gets into the central nervous system and breaks down the central nervous system and causes.
Yikes. Yeah, and unfortunately, because it is good knowledge to have out there, how you can't test a dog for rabies.
Not alive.
Right.
Yeah, it is a test that is a post-mortem test. Mm-hmm. And that's another thing is if people are like, well, I don't want to do rabies. I don't want to do rabies. So my cat never goes outside. My dog never goes outside. Well, I understand 99% of the time that's fine. But if you have a rabies, a cat bite an animal that's not vaccinated, there's a potential if there's any signs or that cat now shows aggression or something, or dog shows aggression that the animal would have to be euthanized and tested. The health department requires that. So it's a good reason to keep them vaccinated. How many calls we get for people that have a bat. We had a bat in the house. What should we do? Well, if there's human exposure, we can test that bat for rabies. And if it was rabid, then you have to go through all the post-exposure treatment. So,
that's why it's important, and that's a good point that you point out there, to keep your dogs vaccinated, and that's one big reason why it is in the law, because humans can contract it. It's a zoonotic disease, right?
Right.
Humans can contract it. It's very fatal to any animal, creature that gets it, human or otherwise. And so that's why the law requires that you have any domesticated animals, such as your cats, ferrets, dogs, that they get vaccinated as soon as they can for rabies, and you keep up to date on that. Try not to let it lapse. That's why Wyoming County and other surrounding counties provide the free anti-rabies vaccine clinics as a way to keep, so you have no excuse to not get the rabies vaccine, essentially.
That's right.
You gotta get it. So those are our core vaccines. Are there any other vaccines that you wouldn't deem are core vaccines but are available out there to your dogs that is something that in certain situations or circumstances you'd recommend they get them?
Mm-hmm. Yeah, I guess one of the main ones would be influenza. I talked about kennel cough, sort of the uptick in kennel cough we see, and kennel cough is sort of like the human cold or flu. Of course, we all went through COVID, recently, but it's just not one virus. Kennel cough is what I call a respiratory complex. It's like, again, sending your kids to preschool. Everybody brings their own little bug to the party, and you end up with a bunch of snotty noses and fevers. Kennel cough is generally very mild and self-limiting. You get a cough or you get respiratory discharge, sneeze, and it usually is self-limiting, but, owners hate when their animal comes home and then starts coughing. I sent my healthy dog to you, and it was kenneled or had its bath, and then, 5 days later, it's coughing. It's unsettling. So, the Bordetella, the para-influenza, and the influenza is a separate vaccine. But I know a lot of kennels would really like, not requiring so much. I know one kennel that's requiring it, but influenza is another one. It's a canine influenza, similar to human influenza and so forth. So there is a vaccine for that. And again, we don't want to over-vaccinate. We want to appropriately vaccinate.
Yes. Yeah. So unless they're going to be constantly exposed to something like that, or they're going to be in that environment that's needed, that's definitely a discussion you should have with your veterinarian to see, what is my pet at risk for, getting these core vaccines done in a timely, appropriate manner, and getting them done by a professional. Those are the big key points I think should be taken away from this discussion that we're having here about getting a new dog, getting a puppy, and vaccines. And to touch upon it, internal parasites when it comes to worms and things like that. What are your most common internal parasites that you see in clinic?
Our most commonly would be roundworms, hookworms, whipworms. We also see a lot of coccidia and crypto. And I'll start with the round hooks and whips. I don't know if people are aware, but most litters will have roundworms and hookworms. And the reason for that is, even if the female is dewormed, those parasites can go into the tissues and encyst, and they're protected from our wormers. They can't get to them. But then when they become pregnant, that's such a stress on the body. They come out of these cysts and they start reproducing, and then they pass them through the placenta to the puppies. And so puppies, most litters have rounds and hooks. Typically we'll catch that at a fecal sample. We routinely use deworming at that first puppy visit. We recommend 2 fecals to make sure that the wormers are doing the job. There are some resistant hookworms that we're finding animals that come out of like real highly populated kennels, shelters, things like that. We're getting resistant hookworms. The greyhounds were known to carry these resistant hookworms, so there's a special dewormer we have to use for them. There are so many wormers available over the counter and prescription, and I'm not saying the over the counter ones aren't effective, but in many cases they're weaker, and their spectrum isn't as broad as what we have available through the prescription form. So, we like to base that on a fecal sample to see what we are. Lastly, whipworms, and they're similar to roundworm and hookworm, but they're very aggressive. They're very damaging to the intestine as well. So you see those animals, and occasionally animals with whipworms will have seizures. So we try and make sure we're taking care of those. Coccidia and crypto, they're a different type. They're protozoal type parasites. So our normal dewormers don't get those. Of course, there's heartworms. Also, heartworms are transmitted by mosquitoes. We have excellent preventives for that. We have pockets in Western New York that are very high in heartworm. Down south, heartworm is rampant. If your dog isn't on a heartworm prevention, they're going to get heartworm. these pockets up here seem to be growing a little bit. And if you get a heartworm dog, you have to remember they have live parasites attached to their heart, and it can cause heart failure. And then the treatment can be risky. Those are worms that are in the heart that as you treat them, they die off. They can go to the lungs and create lung thrombus and so forth. So it's a serious parasite that can happen as well. So that would be the majority of the worms that, not all, but the majority.
Well, heartworm in particular, that's like you said, that's very risky when they get them, and it could be very fatal. But also, I think one of the biggest reasonings behind people not being on a prevention for that is how much does heartworm prevention cost and things like that. But if you outweigh how much it costs to prevent it versus how much it is to treat it, and the gravity of
treatment is an expensive treatment it's over the course of a year. They come through these treatments, and then we have to send out blood tests and continual blood tests to monitor to make sure we maintain that negative status. So some of these parasites can also be transmitted to us. Okay. So especially if you have young kids, you want to make sure that you're doing your best to keep the worm burden low. And part of that too is cleaning up the fecal matter. Every 24 hours, that should be picked up. The longer that the feces stays in the grass or in your lawn or in the run, those worms will migrate out of the stool and then infect the environment. So you should be cleaning up stool every 24 hours or less.
That's a good point.
That is good.
Very good observation, especially if you're like here at the animal shelter, or if you're you have a lot of dogs at home, things like that. Just pick up after your dog for one thing, especially if you're going out in public, but because that could cause a risk to the environment and the community at large too. So that's a very good point there. What are your take on tapeworms when it comes to internal parasites?
Yeah, I guess tapeworms are right up there. I didn't bring them up, but they're right up there, and we see them a lot. Probably more in cats. Tapeworms are transmitted by the animal eating fleas or eating rodents. So these cats, outdoor cats that are hunters, they can continually get tapeworms. Or if you've got a flea problem, we'll get into these external parasites like fleas and ticks, but there we see tapeworms a lot. And a lot of the over-the-counter medications don't have the spectrum for tapeworms. So they're not going to take care of that for you. So to prevent tapeworms, obviously, the hunting and so forth, if they have an outdoor cat, they're going to continue to do that if that's what they do. Indoor cats don't have as much of an issue, but most houses have mice, and if they're eating those, you may see the tapeworms, and then tapeworms just kind of look like dried up rice on the under the tail of a cat or a dog. Usually if a dog has tapeworms, it's because they have a flea burden. And
that's what I was going to ask, because I have a barn cat who's a homicidal maniac. But he's very useful.
Yeah.
But how do I check him, a layperson check their cat for any indications or signs of a tapeworm?
Yeah, so if an animal has a real heavy parasite burden, oftentimes they'll have intermittent diarrhea. They may lose weight. Their coat may look a little unkempt, a little rough, just not that sheen. They may have occasional vomiting. And if you're seeing that with a tapeworm, they'll vomit up roundworms and hookworms. They'll pass tapeworm segments in their stool. You can see under the tail. If they're real heavy, they're visual. You can see them under the tail. And if they are at an at-risk population, we can check a stool sample and deworm them appropriately.
And catching this particular cat to get him to the vet.
Good luck, huh?
You're one of those.
So even in that case, it's like, how do we deworm them? Because good luck getting a pill or liquid. There are actually some good topical wormers as well that, some of these more feral cats, you can use on them also.
It's good to know. I'm going to have to watch this guy.
So with a case like that, couldn't you just worm it every so often? Just preventative? In some wet food, if you could get it to eat a can of wet food?
Yeah, you certainly can do that.
Yeah, that might be the best way. Then you're okay.
Mm-hmm. I don't want him passing on anything to the dog, too, because as much of a homicidal maniac as he loves my dogs.
Yeah.
So he's always moving up against the dog. And they tolerate him. So I don't want him passing everything around,
Okay. Yeah. I'm sorry.
Sorry, I lost my train of thought for a second. I think the feline practitioners group recommends a quarterly fecal sample, and so now I don't expect every person to do that. Yeah. I mean, we have to be within reason, for our pet owners. We don't want to do anything unnecessary. We just want to make sure we're doing things right so that they can be healthy. But yeah, certainly, if you're seeing that or they're at an at-risk, to give them some warmer, certainly isn't a bad idea.
Yeah.
If you got a dog, a cat, or maybe a mole, there's no need to be a fool. Ask us a question, we're ready to go. This is the question part of the show. Ask us about your pet.
Right before we come to a close, is questions from our members. If you're a member of Animal Friends, you get the opportunity to submit a question to our guests and have some of them hopefully answered on the podcast. And so Heather from Perry would like to know, this is probably, we could probably get into more detail about this when we're talking about influenza or some of these those type of diseases, but can dogs get COVID?
It's not very common. There are reported cases, but it's not something that we see very often. No.
Yeah. Yeah, as we humans just got over the whole pandemic of COVID, that's a very good question to ask because that was brought up a lot during that time. Can my dog get this disease? So,
yeah, if your dog's coughing, it's much more likely that it's got kennel cough or heart disease or something like that. Yeah. And if it continues, it's worth exploring, getting checked out.
Yeah. So I guess another question in regards to this, diseases that are transmitted between humans and dogs or cats. We've talked about zoonotic diseases such as leptospirosis and rabies. Is there anything else that comes to mind of a disease that a dog can get that humans can get too?
Yes, there are the intestinal parasites, hookworms, roundworms. There are a number of diseases that we both get. Commonly, the main ones we think about are the rabies for certain. Listeria is another one. It's not very common. Certainly, the intestinal parasites are one that probably we don't give enough thought to. Now, Lyme disease we don't get it from our pets. That's important to note. We get Lyme disease from ticks, like our pets get Lyme disease from ticks. But Lyme disease is something we have to, tick exposure. And we didn't talk much about flea and tick, but we do recommend year-round tick prevention because we have such a high level of Lyme disease, and people are like, "Oh, it's the middle of winter. There's no ticks," but I'll tell you, those warm February afternoons where it gets above freezing and you start to see the snow thaw, we have as many tick people going, "Hey, I've got a tick on my dog," and that early tick exposure is when we see Lyme disease. So, best to be sort of an indirect answer, but Lyme disease is important too.
Yeah, best to be on that flea, tick, and heartworm prevention year round, just to be safe from any of these type of diseases. And then I think lastly, the last question I have here is why, this is in regards to veterinary clinics in general, but when it comes to administering vaccines at vet hospitals, why is it that sometimes dogs or cats are taken away from the room to go into their treatment room or their other room for getting these vaccines?
A number of reasons, but that's a great question. In some cases, the owners are very nervous to hold. They don't want to watch. So we'll take the pet back. And our technicians are so good, at handling the animal gently, at protecting us from getting bit, at protecting the pet from injuring themselves or biting someone. So sometimes we just pull them away. And oftentimes when a dog or cat that's anxious gets away from the owner, they'll actually relax a little bit. Sometimes a lot of these dogs have some fear aggression from being in a small room, or they're trying to say protect their owner. And you get them back and you can get down with them, it just sort of calms them down. So we take them back there to do that. And in some cases, in some cases we take them back to protect ourselves because the owner may not be able to, they don't know the technique to hold or restrain. And we want to make sure that they're given properly without, stressing the animal or putting anybody at risk. So those are a few reasons why we do that.
Yeah. Very good. Very good. It's good to have an understanding of that, especially as our owners of these dogs going into the vet clinic. And sometimes it's necessary to take them outside of the environment where the owner is, so the dog is calm enough and has a pleasant experience when getting these needed vaccines and services. So it's good to have that mindset that's okay if the technician or the veterinarian takes them out of the doctor's office to give them some of these services. I think the only other thing we didn't touch upon that we've mentioned briefly, and just to throw it out there, when it comes to spaying and neutering, we've talked about animal shelters. Part of this new law that's going to be passed at the end of 2025 is they have to be of a certain weight in order to get spayed and neutered, and they have to be spayed and neutered before they leave. So there's these big question marks out there, and this could be a longer discussion for another time too. But when it comes to spaying and neutering, some people wait 6 months, some wait a year, but now the law is saying for animal shelters they have to be within a certain poundage and they have to be done. What is your take on spaying and neutering in general when it comes to when to get it done?
One size doesn't fit all. I think it's a great service that our shelters are doing at getting these animals spayed and neutered, and that way it takes that off the plate for the owner. Sometimes that's a financial responsibility they can't handle. But many times just making sure that it gets done, because we don't want any more, we don't need any more unwanted, dogs or cats for certain. So, if the animal gets gets adopted and then, or you get a puppy, typically in the vet clinics, we've always recommended doing them around 6 months and still do, to some degree, especially small and medium breeds. Larger breeds, we do get into the discussion of delaying that to about a year so that these animals reach their full maturity. And there is some research that backs up that might help prevent some arthritis in some of these larger breeds that are prone to the hip dysplasia. Now, if someone says, no, we don't want to have to deal with the heat, or we don't want some of these male characteristics that come in when they reach their full sexual maturity. We don't want them humping the couch and things like that. Then most certainly we still do it at 6 months because, you have to look at the whole situation. I don't think there's a right or wrong answer, but in general, large breed dogs now, dogs that are going to be, 50 plus, I typically do at a year. And then it's medium to small breed dogs, I'll still do it 6 months. But if we can do them younger, the reason why we like to wait 6 months is anesthesia. We want them to have plenty of body reserves for anesthesia. Anesthesia, we anesthetize hundreds of animals, and these smaller animals, they get cold, they get hypothermic quicker. If there's an emergency action that needs to take place, the smaller animals are more difficult to do that with. So we want to prevent any anesthetic issues. Those are really bad days for us, and thank God they don't happen often. But and we've come a long way with our monitoring techniques, our anesthetic protocols, but that's why we don't want that really, small puppy or kitten in our office until they have, a little more.
Yeah.
I think that's one of the hardest part of the new law that I'm having trouble dealing is they can't leave here without being done.
Yeah.
And so this last litter at 8 weeks, some of these dogs are 4.5 pounds.
Right.
Little puppies, females and little males. And so I've been concerned about that. I understand the thinking, but it's at the same time, I'm nervous about what we may have to encounter and that we may, not have a puppy survive just the anesthesia alone, or something, But I get why they're saying that, but I just don't like it in shelters.
Yeah, I think I would agree with you.
Yeah.
Also, that I know that when they're creating laws, they're trying to get everybody's best interest, but sometimes, there are situations where that's not ideal.
Yeah. And we have a program now. The state requires if a dog leaves unneutered or unaltered in any way from a shelter that there's a deposit left that they can't get back until they neuter. You give them a certain amount of time to get that to get their deposit. And we do find, Daryl and I have discussed this multiple times, that about 2/3 of the people do send in the spay neuter certificate to get their deposit. Yeah. Then at 1/3 either doesn't neuter, change their mind after 6 months, or money was tight and they thought, well, we'll wait, and then they never do, or they just don't reclaim their deposit. But so it's frustrating when you say 20 dogs out of your shelter leave unneutered a year, half of them get neutered and get and there's 5 or 6 out there making more puppies. And so I get why they're doing it. And they did say when they wrote this law that they confirmed with veterinarians, and they felt that the greater good would be neuter because the potential for more unwanted and unaltered dogs out there is higher. So that's I had a long discussion with them and said, I don't like this. No, I it's tough place to
squeeze
be.
Everybody into the same, but we certainly, the end game is preventing those unwanted litters for sure.
Yeah.
Well, thank you so much for taking becoming a part of this whole project here that we're doing. Is there anything that you want to, as we conclude today's episode of the podcast, leave for our audience to take away from this? Are there any key points that you want them to take away from our conversation today?
Yeah. Well, first of all, thanks for having me. I appreciate it. You having me. I would just like to say, and we're in the veterinary industry, we're in there because, we love these animals and we try and do what's best for them. So, I would, urge you to when you get in a puppy, kitten, whatever, adopting, look at all your options, research it, look into it, spend some time thinking about it, talk about it with your family, and remember, it's going to be a commitment, and we get so much back from our dogs as companions. I mean, they're one of my favorite things to do is my wife and I, every night we take the dogs for a walk, and we spend about an hour just walking and talking and with the dogs, and the dogs get so much out of it too, and there's such a great part of such an enriching part of our life that I think everybody should have the opportunity to do that. But don't go into it on a whim. Don't do it on a knee jerk. Just prepare like you would anything, and it's much more rewarding. There's work. It's work. It's not easy, particularly those first few months. But it is well worth all the work.
Yeah, my favorite part of the day is going home and seeing them.
Yeah.
Yeah.
They don't have a bad day,
No, then they want me or they want us so badly. They're just all over us. Yeah. That's my favorite time.
Yeah, they're really...
Doesn't matter if you've been gone an hour or 12 hours. To them, it's all the same. Yeah. You're home.
Well, thank you again for coming on to the first time. Hopefully we have you come back on later for another topic someday. But thank you to everyone tuning into this episode of the podcast. Please check out our website, www.animalfriendsofwyco.com, to get any of the references that we've talked about today. And check out our YouTube channel for any of our educational videos where Dr. Wolf's video is going to be on there. Thank you so much.
Goodbye.
Bye.
Thank you for joining us on this episode of the CHOW Podcast, hosted by Animal Friends of Wyoming County. To learn more about us, visit our website at www.animalfriendsofwyco.com. And if you're interested in adopting a dog, please call the Wyoming County Animal Shelter at 585-786-8938. This has been a production of Knox Luna Films, LLC.